Hello, everyone. This is Dr. David Pascal from the Pascal Health Institute in beautiful Cary, North Carolina. We are excited to be here and talk about a new machine that I have in my office. It is called the Sell It, and it is a machine from Germany, actually made by a German company called Tur, that has been around making medical devices for over 150 years. Finally, something that's even older than I am. That's impressive. The Cellet is a machine that does intermittent hypoxia. I'll explain what that means in a second. But the bottom line is it is fantastic for everyone, and especially fantastic for people with CRPS, complex regional pain syndrome. So we are going to dive into the benefits of intermittent hypoxia. Intermittent means it comes and goes, and hypoxia means decreased oxygen. And this type of machine has been around for a long time in various forms. But basically, what happens is a person wears a mask, and the mask is connected to an oxygen machine, and they're breathing oxygen. And most machines this way, like we have one in my office I've talked about in the past called Live O2. That's also an amazing machine. But what happens is you're wearing a mask, you're hooked up to an oxygen concentrator, and with the Live O2, it's giving you extra oxygen, which you need because you are exercising. People in our office are either lifting weights on a hydraulic weight machine, or they are on a recumbent bike and they are cycling. And what happens is, of course, when you exercise, your need for oxygen goes up, but that's fine because you're breathing extra oxygen. The trick, though, is then we turn off the oxygen. The percentage of your oxygen in your blood begins to drop. When it drops, that creates a panic in the brain saying, hey, we need oxygen. And through a physiologic reflex, which I'll get into in just a sec, it triggers the arteries to expand, take in more oxygen to make up for the lack of oxygen. Then, when the arteries are expanded, we turn the oxygen back on, and so more oxygen gets flooded deeper into the tissues of the brain, and oxygen is vital for brain cell repair. So how does that happen? Why does that happen? How is Live O2 different from Cellet? Um, we see a lot of CRPS patients here and have for years and years and years. And most CRPS patients cannot do physical exercise. A lot of them are in wheelchairs. It's too painful, on and on and on, as you know. And so we haven't been able to put very many of our CRPS patients on the Live O2 because most patients with complex regional pain syndrome cannot do significant physical exercise. Well, this past fall, I was in Europe for Medicine Week, which is one of the world's largest alternative health conferences. They've been doing it in Baden-Baden, Germany for, I believe, 57 years. So quite a while. Doctors come from all over. They have amazing lectures, and they have this giant vendor hall with all sorts of machines right out of Star Trek. I mean, just crazy science fiction things, and straight up normal things like supplements and lasers and whatnot, but really some very cutting edge devices as well. I like to go there and see what they have and get what I can because, of course, I am trying to do all I can to heal my patients as quickly as possible. And that does require cutting edge technology. So this last November, I saw the Cellet. Cellet is different. It is intermittent hypoxia. So you do have enough oxygen to breathe, and then the oxygen decreases. But one of the great things about the Cellet in particular is it's passive. A patient is just laying down in our office in one of our zero gravity chairs, and they have an oxygen mask on. And through a set program, what happens is it will turn the oxygen up and then turn it down and turn it up and turn it down. You're hooked up to a pulse ox machine, so a little device that's reading the amount of oxygen in your blood. Everything's totally safe. But what happens is the way that our body is designed is our arteries are carrying blood from the heart out to the body. And then our blood veins are taking the blood back to the heart. And we all know this. But maybe one thing that you didn't realize is there are three layers to an artery, and there are only two layers to a vein. Well, the outer layer is like the protective layer, and the inner layer is, super smooth and special because that's what the blood is in contact with. But with the arteries, there's a middle layer, and that middle layer is muscle. And this is vital for controlling our blood flow around the body. Like when you are sitting down and then you go from sitting to standing, or we'll do it even better, you're laying down, right? So now the blood is just, it's really easy to go to the feet and the organs and the brain. But when you stand up, now all of a sudden, because we're standing, the head is elevated, the brain is elevated, and it's not going to get enough oxygen. So if that happens, people would just pass out, which is what POTS, positional orthostatic hypertension, is all about. And so that's a very bad design flaw. So that's not how we're designed. This is where that middle layer, the muscle layer, comes in handy. When we stand up, there's special pressure gauges in our arteries, and they say, hey, the blood flow to the brain's going down. We don't want this. So instantly, the middle layer of the arteries constrict and help pump the blood back up into the brain. So the arteries down in our legs actually, let me restate that, in our legs and our trunk, those arteries are going to constrict so that the blood gets pushed up into the brain. Those arteries will dilate. Have that backwards for a sec. And so this is very important for controlling the flow of our blood. Conversely, the veins do not have this middle layer, so they rely on the muscles around them to squeeze the vein, kind of like a tube of toothpaste. So when you want to get the blood back to the heart, this is why movement is so important, because when you contract a muscle, that will push on the vein right next to it and help push the blood back to the heart. Well, with the intermittent hypoxia, what's going on is you're laying down, everything's fine, you're breathing oxygen, things are normal, you have normal levels of oxygen in your brain or in all of your blood. We like that to be around 99%, 98%. And then we lower the oxygen, right? The machine, the mask that you're breathing decreases the amount of oxygen. So that's hypo. Hypo means less, hyper means more. So hypo-oxygen, less oxygen. And now the brain says, we are panicking, we need more oxygen. So all the arteries in your body constrict, the arteries going up to your brain relax. That vasodilation allows more blood to get into the brain. So even though each unit of blood has less oxygen in it, because you're getting more units of blood because of the increased volume of blood going to the brain, is helping to make up for that, because the body will do all that it can to protect the brain first. Well, that's all well and good, but what are the benefits of having less oxygen? Well, there's a few things. When you decrease the oxygen to a cell, the cell takes that as a challenge. right, as a stressor. So it says, oh no, we have less oxygen, so that cell is going to work better at dumping its toxins, work better at becoming more efficient, work better at repairing any damage within the cell. And the main energy unit in a cell is the mitochondria. And mitochondria are vital for cellular function, for our health, and it's fairly difficult to stimulate full body mitochondrial repair unless you're doing intermittent hypoxia, because this process of too much oxygen, too little oxygen is stimulating every cell in your body, all your brain cells and every other cell. So what we get is systemic whole body stimulation of your mitochondria, which repairs your mitochondria. We get all body-wide, cell-wide stimulation of the cells to dump their toxins and repair. As a matter of fact, in Europe, the way that they are treating long COVID is with intermittent hypoxia, particularly with the Cellet. Trying to stay hydrated here. So now let's get back to what a session looks like. You lay down, you have a mask on, the session's going to be about 30 minutes, and you just lay there. Try to take a little nap if you can, and you're breathing oxygen, and as the oxygen goes down, that'll trigger vasodilation, that'll trigger deeper oxygen into the brain, which will help heal your brain. It'll actually, with that extra oxygen in and out, up and down in the arteries, we know from clinical research studies that it's going to help decrease the inflammatory markers in our blood. That is a great thing. And of course, with CRPS, one of those components is we have a lot of inflammation. And so the intermittent hypoxia, the Cellet, allows us to passively, to just lay there and get these anti-inflammatory benefits, get the benefits of cellular repair, get the benefits of mitochondrial repair. It boosts our immune system. It helps decrease brain fog. It decreases pain in our body. It's just an amazing machine. There's only a handful in the United States right now. We have one that's in our office that we're using, and we have another one that is on its way, should be here sometime in mid-March, and they are just fantastic for CRPS pain. So I don't know if we have anyone that might have a question. If they do, I would be glad to take that live. If not, if you are watching this on a recording of my live and you have a question, you can post your question below this video, or you're more than welcome to send us a text or send us an email. We try to stay on top of all of our communications. Sometimes we run a little slow because we have people calling us from all over the world with all sorts of very interesting questions. So my first role is education, to help answer the questions that you have, and my second role is to do what we can to bring you on in and help get you into remission. So this is my latest device, the Cellet from Germany. Absolutely amazing, amazing machine. And I look forward to answering any questions that any of you have. We are doing these Facebook Lives every 2 weeks on Tuesdays at 2. Feel free to join us, participate, and I wish you all an amazing, healthy, or healthier 2025. All right. Bye for now.